Hello, my professional colleagues. My name is Mrs. Kemi Ogunyemi. I'm a commissioner on the board of the Health Service Commission, Lagos State. And first of all, I'd like to congratulate you all on year 2020, Year of the Nurse and Midwife. So part of the program that I was privy to hear about was that there was going to be a kind of awareness, health education from the nurses to patients, to the public about cancer care. Basically, I'm an oncologist, nurse specialist, and cancer care has always been my passion. It's a specialty I like. I enjoy in that those patients I always feel are everyday heroes, because it's really not fun at all in any shape or form when you're fighting for your life. Every single nurse is a health educator. In other words, every single nurse has the skill, has the talent, has the education to actually teach or educate the public or anybody you come across, your patients, on specific illnesses or how to care for themselves. So we're going to talk about preventing cancer. But first of all, what is cancer? All of you, as I'm talking to you, you all know what cancer is. Everybody has either seen a cancer patient, has been touched by cancer, maybe in the family, or have known somebody who has died from cancer, or you've heard about cancer throughout your training course. So cancer is when abnormal cells proliferate. Abnormal cells keep on dividing, they keep on producing, and then they destroy tissue, body tissue in our system. So there is no cause, no specific cause of cancer. They're just risk factors. And it's these risk factors that we as nurses need to enlighten the public about. So for example, when it comes to breast cancer, what causes breast cancer? Nobody really knows. But there's a general belief that there's some factors that we can control in ourselves to prevent cancer. And I'll also tell you some screening tools as well that are available for the different types of cancer. The number one cancer in women is breast cancer, which I'm sure you're all aware of. It's also called a silent killer. Some people don't even know they have it, and then by the time they know they have it, it's a bit too late. So let's talk about the predisposing factors, the risk factors. The first one I would like to talk about is familial tendencies. So in other words, if cancer runs in the family, maybe somebody, a grandmother, a grandfather, a father, mother, had one kind of cancer or the other, somebody from that line, that family line, may be predisposed to cancer. It does not mean that those who have never been touched by cancer in the family may not get it. It's just that if you have a history of cancer in your family, then there's a higher risk of cancer, especially in cancers like breast cancer. Breast cancer, we know that usually 1 in 4 of an offspring will have cancer if the mother had breast cancer. Another thing is our lifestyle. So smoking, for example, smoking we know is bad for your health. Not only does it cause heart disease, but it can also predispose you to lung cancer. So when we're talking to our patients who smoke, we need to let them know that they need to stop smoking. Drinking as well. Drinking can be toxic to the body, and you all know it's usually the liver that suffers when people drink too much. Another thing is lack of exercise. So when people don't exercise, they're just sedentary and they're not doing much, just sitting in one place and just eating. That's also a predisposing factor. Obesity, when you're too overweight, also predisposes us to cancer. So those lifestyle things we need to enlighten our patients about. Another thing is there's some drugs, hormones. So for example, if you take hormone therapy, especially people who are going through menopause and they want to stop it and they're taking hormone replacement therapy, that also can predispose you to cancer. Another predisposing factor is diet. When they say what you eat can kill you, it's literally true. So, for example, if you don't eat enough vegetables, you don't drink enough water, your colon suffers. So you have to have a lot of roughage. But you do need to take a lot of roughage. You need to take a lot of vegetables, very, very important. A lot of fruits as well. Everybody should take at least one fruit a day. They always say an apple a day keeps the doctor away. That's basically what it means. And also, if you really think about it, a lot of things that we buy in the supermarket that are packaged, we really need to look at what is in them. So I'll give you an example, something that is carcinogenic, in other words, can predispose you to cancer, is what we call MSG, monosodium glutamate. It's in some foods, it's supposed to help you, it's supposed to make the food, the products sweeter, to keep it as fresh as possible, but they are carcinogenic. So we have to really be careful to look at the labels of all these new things that are coming out in the market and what is in them. Breast cancer for women, it is so important to help prevent breast cancer. Apart from all the things I've listed that are predisposing factors, all the things I've listed that you need to do, your lifestyle, how you live your life and all that, you also need to be conscious of what your body is telling you. So for example, for breast cancer that was going on, it's so important that every woman is familiar with her breasts. All women should know how to examine the breasts. And if you do not know, you should go to your primary healthcare centers. There'll be somebody there to teach you, or your secondary hospitals, or even your tertiary hospitals. There will always be somebody because this is very important. You know your own breast. Nobody knows your breast more than you do. So monthly self-examination is very, very important. If you feel anything that is unusual, or for those of you who are married, if your husband feels anything that was not there before, like a lump, be it soft, be it hard, be it painful, it's very important, you must go to the doctor. Let the doctors do a good clinical breast examination, and then we'll do what we call a mammogram. We always say it's also best to do it at least long after your period, not before, because as you all know, sometimes you do have lumps. You can feel lumps during your periods. Depending on your age as well, it's very important. I have seen 30-something-year-olds with breast cancer, but typically you must have a basic mammogram from age 40 to 50. From 50, it's almost every 2 years that you must have a mammogram. And basically the mammogram is like an X-ray. It will just examine your breasts and see whether there are any lumps. It's very early detection. I need to say something. For cancer, there's no cure. However, early detection is, as far as I'm concerned, is a cure. In other words, if you catch it before it even spreads, or it grows bigger, a tumor grows bigger, then you're done. I know people who have detected a lump in their breast, they've removed it, they've checked it out, they've cleaned the whole area, and they are cancer-free. And so that is very, very important, early detection. Cervical cancer is a number 2 also in women. Cervical cancer is probably the only cancer that we know there's a vaccine that can prevent it. And that vaccine is available to people as young as 9 years old. So outside the shores of Nigeria, in the UK, in the US, 9, 10-year-olds are being given this vaccine. Why? Because cervical cancer is 98% of cervical cancer is caused by what we call HPV. That is human papillomavirus, which means that there's a virus that can start the precancerous stage and then cancer. So what happens is with cervical cancer, a pap smear should be done every 3 years, especially if you're sexually active. What the virus is actually is contracted through sexual transmission. So the vaccine is given to male, boys, and women. However, if you haven't had your pap smear done and you're sexually active, you have to have your pap smear done first. When you're negative, then you have the vaccine, and there are 3 doses of the vaccine. This is very, very important because cervical cancer, at least you can say, when you can totally prevent it. And it can also be detected very early. And it's not that once a precancerous stage is detected, you're going to have chemotherapy. It's nothing like that. So it's very, very important that we go out there and ensure that mothers, daughters, wives, sisters, just ask, have you had your pap smear? And if you've had your pap smear, you make sure you do it every 3 years to ensure that you do not have that. So let me talk about lung cancer. Lung cancer, people think it's only people that smoke. However, if you are around people that smoke all the time, we call you a passive smoker. And we have seen passive smokers also develop lung cancer. And lung cancer, it doesn't matter if you smoke, obviously, because if you smoke, you're more at risk of getting lung cancer. If you do not smoke, but you're around people that smoke, then you're just as at risk, you're at high risk as well to cancer. So cancer in itself is not something that nobody wants to hear the word, the big C, we call it cancer. However, our lifestyles, what we do, how we look after our bodies, how often we go for a medical checkup is extremely important. And I think this should be passed on. The 4th of February is Cancer Awareness Day, and it's for everybody, male, female. Children also get cancer, and that's usually, we won't go into that because that's, like I said earlier, it's like either something has gone, there's a mutation that has gone wrong somewhere. And that's why it's very important also when you notice a child or your child that is not doing things correctly, or they're just not feeling well, or they tell you they're not feeling well, you need to take them to the doctor. And you yourself, if you're not feeling well, please do not self-medicate. Do not listen to your neighbor that says, I had that, this is what I should take. Go and see your doctor. It's so, so important. And that's basically what we would like to spread out there, to tell people to look after themselves, to try and prevent illnesses. And also, should they suspect illnesses, they should go and see a doctor. I hope that has been helpful. I am Mrs. Kemi Ogunyemi, Commissioner, Lagos State Health Service Commission, and on behalf of myself and all Lagos State nurses, this is the year 2020, which has been dedicated by the World Health Organization as the year of the nurse and midwife. And we are here to help you attain good health. So I wish you all happy, good health is what I should say, and happy 2020 year of the nurse and midwife. Thank you.